Thank you for tuning in to the Dear Momma podcast, part of Airway Circle's radio station. This is episode 5, and I am your host, Dr. Catherine Murphy. Today, I'm so excited to have our guest, Bre Grzych. We're going to start it off with a quotation that's going to kind of embody today's whole message. By Brene Brown, she states, "Grace will take you places that hustling cannot." So I have chosen Bre as our guest today because she has taught me an incredible amount beyond just acupuncture. So she is a board certified acupuncturist and massage therapist with training in nutrition and herbal therapy. She holds a bachelor's in communication from Purdue University and 2 master's degrees from Midwest College of Oriental Medicine, as well as multiple certifications. Bre has extensive training in pediatrics, orthopedics, and mindfulness-based interventions, allowing her to create a true mind-body therapy that blends Eastern and Western medicines for all ages. Since becoming an Eastern and Western medicine practitioner and a mom herself, her focus and practice has been creating healthier families by offering therapies that are practical, integrative, and holistic. As a mom, she knows the desire to help kids achieve optimal health, but also the deep need for parents to be cared for and healthy as well. Bre places emphasis on self-care and at-home therapy to accelerate the true healing that occurs in our homes and not just in the treatment rooms. The co-creation of Take 3 From Me has taken her belief in self-care to the next level, blending elements of all of her training to support and encourage others to take care of themselves so that they can continue to grow and become the best, healthiest versions of themselves. So, Bre, thank you for taking time out of your day to talk with us. And when I started saying that the reason why I've invited Bre here is because she's taught me so much more than just acupuncture. Brief history about how we met. I was going through the process of trying to have more increased milk production. Do you remember that, Bre?
I do remember that, yes.
And I was like desperate, trying to find ways to increase my milk production. I'm like, let's try acupuncture. And I walked into her room and immediately there was this connection. And years later, I can't believe how many years later now, not only has she just taught me so much about Eastern medicine and how well it can really weave with Western medicine, but truly that pausing sometimes just for a moment can change the whole day. So, a spoiler alert, she is the co-creator of Take 3 From Me, but today is not the reason, that's not the full reason why I invited her today, because I'm going to have her come back a few times because there's so much to talk about. But I would really like to first get started by having Bre explain to us, really what led her to the practice, from massage therapy into Chinese medicine.
So it actually all started, my first job in high school was a chiropractic assistant and a receptionist. So I was answering phones, scheduling, and then just kind of helped setting up treatments. And as much as I thought chiropractic was super interesting and amazing with how she was able to help, I really connected with the way her massage therapists were able to make these amazing changes in the patients. And it was almost, in that practice, a prerequisite. You had to see a massage therapist before you saw the doctor because she truly valued how well the muscles and the skeletal system work together. And also I spent a lot of time talking with these therapists. And so I really connected and had a relationship with them. And I always knew I wanted to be in the medical world, but not really sure where. So I said, you know what? I really love what they do. And I love how they're such an integrative part of this wellness care. Let's go do that. So I became a massage therapist first. And that was kind of my way of just getting my feet in the door. And it gave me more time to figure out where do I want to go. So of course I was looking into chiropractic because I was exposed to chiropractic, physical therapy, and even osteopathic medicine. And I couldn't really find the one that felt home to me. I shadowed a whole bunch. And then on a whim, I don't even remember where I met, but I met 2 acupuncturists and they invited me to their clinic in Chesterton. And I was just enthralled. I was taken aback. It was an amazing experience. I spent all day with them. And I remember leaving like so excited about it, but completely exhausted because there was just so much to take in. And so I actually decided to go to school for acupuncture right about the same time I was graduating from my massage therapy program. So I didn't really take a break. I mean, the break I think was maybe a month and a half long between when I graduated and started my job as a massage therapist. And then I rolled right into school for Chinese medicine. But
Oh.
that's how I got started in both of those fields.
And at that point, how many kids did you have already?
So I had my first child until I was in school for Chinese medicine. So I was kidless in the very beginning. And then I ended up having two of them one during and one right at the tail end of my initial degree up in Chicago. So then I had two, and then I actually put the rest of the degree on hold. So the first part is just acupuncture. And you can leave that as your like terminal degree. You can become board certified in just acupuncture alone. But that was leaving out a whole aspect of Chinese medicine, which would be the Chinese herbal therapies, nutrition therapy, and also a little bit more of lifestyle medicine, where we got into the other parts, not just the biomechanics of acupuncture in the body. So after having two kids, I took a little break. Then I ended up being pregnant with my third. And then I decided, you know what, I'm pregnant again. That's a good time to go back to school. So that is when I went back and I finished, and I got the true master's of science in Oriental medicine, like as its completion, the entire paradigm. And gosh, how did that timing work out? I think I ended up having my third and then graduating like a month later, or maybe it was the other way around. But yes, that was how I did it.
And it's 4 years, correct?
Yes. So the acupuncture alone is about 3.5 years. And if you do decide to do the entire program, like I said, including the rest of Chinese medicine, that is 4 or just over 4.
Wow.
So yeah, it's a lot of schooling. And, at the beginning, it's, again, super exciting, but super exhausting because it's a whole new way at looking at health, a whole new medical paradigm, a whole new language that you're learning. But it's exhausting because a lot of it is in pinyin, which is kind of like translated Chinese. So it's not true Mandarin Chinese, but it's the translator, almost like English-ified version. So you're learning a lot of pinyin, so another language, while trying to learn, if you haven't been exposed to it, anatomy and physiology, pathology, all of that. So a lot, but again, it's that balance of exciting because it's new and totally awesome, but then exhausting because, oh my gosh, it's so much.
So can you explain that a little bit more? I remember it's been years ago since you were kind of talking to me during our session, because I would spend my acupuncture sessions with Bre. I would look forward to them because I would feel so much better, but also because I was like, what question am I going to ask this time? I'm so curious about this. And sometimes then we would, the tangents that we would go off on. So tell me a little bit more about, is it pinyin? Did I say
yeah,
right?
So pinyin, it's pinyin. And that's like a great example would be there's an acupuncture point, and it's called Zusan Li, which translates to 3 miles. And so Zusan Li is not technically Mandarin or any of the other dialects of Chinese. It is almost like, I would say maybe more of medical terminology, if you will. So I wish I had a better explanation other than it's kind of just translated Chinese, where it's not specific to, like I said, a language or a dialect of the language of Chinese. So it's very much, again, more of a medical terminology where it's generalized, where no matter what dialect of Chinese you speak, this pinyin kind of translates across all of them.
Now, remind me, because again, I should have mentioned this before we got on, but I remember when the very first session you had me stick out my tongue, and I think you have your patients always stick out their tongue, correct?
Yes.
And when I'd asked you why, I think at first I was a little like hesitant. I'm like, oh, should I ask her why? Now, did you say that was something that was like written how many years ago and they had to translate it so many different times? Is that what you had explained about the rationale about why you look at the tongue first? Or one of the first things?
So in Chinese medicine, you have to remember that this medicine was developed before all of our amazing technologies that we have today. So they really didn't have a way to look inside the body. So they look at the outside and see how does the outside reflect what's going on the inside. And the tongue was a really great window to what's going on internally, because if you think about the tongue, it's kind of like half in, half out in a way, where, it really is deeply connected to our internal organs, especially the digestive system, but also is exposed to the outside world, and it is visible to the outside naked eye. So that's why it is one of the 7 diagnostic tools that they use in traditional Chinese medicine diagnostics. Chinese medicine is several thousands of years old, but what you're referring to in terms of the translating is not necessarily just the tongue analysis, but the main tenet you'll hear about with acupuncture and Chinese medicine is the concept of qi, which qi is this imaginary invisible force that kind of circulates through these invisible vessels in our body, right? So it all sounds very like, wait, what? That has been translated so many times, and actually the concept of it being energy or this invisible substance was translated by a French banker. So, right. A weird thing then you think, well, how did this French banker get his little 2 cents in the medical world? But somehow he did. So anyway, and it's been retranslated so many times. And now the most commonly accepted definition of what qi is, and I love it because it actually ties that energetic portion to Western biomedicine, is some people look at it as being nitric oxide or oxygen. So it's one of those gaseous substances that's circulating within our veins that helps kind of control all the actions, our cellular actions of our body. So it's that little bitty driving force that isn't, necessarily blood or protein, but it's one of those much smaller particles that has such a huge role. And it's a universal thing. It might have different functions in different systems in the body, but it is used throughout the entire body. So wow. 2 different things there. The tongue diagnosis being one of our main diagnostic tools, and then also the hiccup, if you want to call it that, in translation as to how it became energy when really it's a physical substance.
So can you tell me a couple of the things that you look at the tongue?
Yeah, absolutely. So one of the obvious, or the first things I should say that we look at is just the overall shape of the tongue. I know you and I have talked about this before. We look for tooth marks on the tongue as a sign of things being obstructed, not flowing, water retention, and swelling. A lot of times people will have a swelling condition that can lead to tooth marks on the tongue, or even just a systemic inflammatory condition will lead to tooth marks along the tongue. So that's what we're looking for. Other people have very pointy and narrow tongues. So we're just looking at the overall size and shape. And then we're looking at the quality or the texture of the tongue coating, what a lot of people will sometimes even scrape or brush off. Mm-hmm. That tells us a lot about the health and the vitality of the digestive system. How well are things being digested? And then we also look at the veins that you can see on the tongue, predominantly on the lower or the bottom portion of the tongue. That gives us just kind of an insight to what we call stagnation, or a lot of times blockage, restriction, whether it be a musculoskeletal issue where restricted range of motion can show up in that. Or even if you practice more internal medicine, you'll be looking for signs in those veins and the coloration for are there coronary blockages?
Wow. So you're looking for the color, and then do you look at how prominent the veins are, the vasculature underneath? Mm-hmm. What else?
So for the vasculature underneath, we're looking for, are they super short and shallow, really just at the root of the tongue? Do they extend all the way up to the tip of the tongue? If you look closely, you'll see an imbalanced left side versus right side of the tongue. You can even see different hues of color. Is it more along the purple end of the spectrum versus the green end of the spectrum? Just all shapes, sizes, and qualities that you can see in them. And they all mean something a little bit different.
And then are you able to then arrange your acupuncture points to then help address those areas?
Yeah. So the way I describe how I select my point prescription is whatever you're coming to me for, we'll just easy answer is going to be pain, right? You're coming in for neck and shoulder tension. So I'm going to address that with a certain few points that are usually going to be local to the area or along the muscle and fascial chains. But then also, if you remember, I ask you a whole bunch of questions.
Mm-hmm.
And then I look at your tongue, and those are going to be the clues to what's going on inside that could be leading to this more external presentation of pain. And that's going to be like the other half of my point prescription.
Okay.
So if your tongue is showing me what I would call as a damp tongue, so a larger tongue, lots of tooth marks, kind of looks very wet as opposed to dry, I'm looking at you have some sort of damp swelling or inflammatory process going on. So I'm going to select points that are going to help reduce systemic inflammation and swelling, as well as local points then that are going to be more like along the muscle, the motor points of the muscles, the trigger points in the muscles, or points along that fascial line to help re-lengthen the muscle tissue.
Now, how many estimated acupuncture points are there?
So in one of the classic texts, they say there's 365 points because there's 1 point per day.
Oh, okay.
That is a very low estimation. There are roughly 360 some points on the 12 main meridians that we have throughout the body, which, while the meridians are not identical mirrors to the fascial planes of the body, they kind of do line up with a lot of the different, the anterior, the posterior, the sagittal, or the transverse fascial planes that we have. So again, there is a link between what Chinese medicine is saying in these meridians to what now Western biomedicine is seeing in fascial planes. But anyway, so there's roughly 360 some of those points. And then there are hundreds of extra points which don't fall on a specific meridian.
Okay.
So a lot.
Because may I share, this is very impromptu because this just happened. May I share a little bit with the advice that you had given when I reached out to you? And I said,
absolutely.
So listeners, I got my lip released. I had my tongue released about 5 years ago. And I will just say so side note, doctors shouldn't diagnose themselves. And I was very like, oh my gosh, I need this done. I need this done. Well, I didn't ask anyone to evaluate my lip. And now here I am a week post-op of my lip done. And I wish I would have done it before because I actually saw Bre to help me with some of my facial asymmetry. Well, I reached out to her because I was having no tenderness at all with my lip. In fact, I felt such a nice release with it. It was unexpected because I kind of think, oh, it's just the lip. Well, then I had some tenderness around my ear. And I sent her, I'm like, okay, it's right here. What is this? And she sent me this, she said ST Meridian, is that right?
Yep.
Yeah. And I started to look it up and I'm like, oh my gosh, there's so much. And so I went to the chiropractor. I'm like, I need to be adjusted. And then, can you, and he immediately saw what was going on. I'm like, well, check my feet because my acupuncturist said this. And so check my feet.
Yeah.
Once he got my feet in check and we looked at that point, then it went back into place because I had a little bit of my zygomatic arch. When this was released, I must have been holding in a lot of pressure there, right?
Mm-hmm.
So I would love for you to explain anything about that, Bre. Just in general, when I looked up and I started seeing all these points, I'm like, oh, there's a lot of lines. This is why I need to talk to Bre more. So you can either talk, I would love for you to share anything about that because that experience for me with the lip release and how you could help guide me and didn't even see me. And really, otherwise, I still would have had that little bit of tension there. Now I'm tension free. Things are more even now. So good work to the collaborative care.
Right. Well, thank you. So that was actually for me when I knew that you had that lip release done. It was very obvious to me where there was going to be an issue because the upper lip and gum, not so much the external lip, but the inside fold of the lip as well as the upper gums relate to the internal channel of the stomach meridian. So like, again, one of those like, oh, well, I know exactly what's going on. And so knowing that, and you were, talking about some musculature going on along the side of the jaw. And while those all play a role, I knew that there had to be something going on with that meridian just because of the structure that it was in. And that meridian does go above and below the zygomatic arch. And then as you found out, I told you the point was on your foot because it transverses all the way down the body to the bottom of the foot. following some of the fascial lines. So with fascia is so interesting because it is head to toe and it is really truly one big organ or one big sheet of an organ that you might have a restriction on one side of the body and completely far away is where you're having the pain. Well, for you, where you had this release, you opened up some of that fascial tissue, but there was a restriction way further down at the bottom of the chain that wasn't allowing that sheet to really open up and glide the way it's supposed to. And with Chinese medicine, a lot of times we'll work on the exact opposite end. The distal points, the ones furthest away from the midline, have the most power because those are the areas of restriction that are least commonly addressed. If you were to go to, say, a massage therapist and explain that to them, they're going to work on the structures and the fascial part right close to it. And same thing with your chiropractor was working to adjust. Not that there wasn't an issue there, but you can do all you want here. It's still going to be wrinkled or restricted unless you work on the entire plane, the entire line. I say it's kind of like ironing a shirt. If you have a wrinkle, wrinkles all over, but you have a wrinkle that goes from your shoulder, across your body to the opposite hip, you can iron out the opposite hip all you want. You're still going to have the wrinkle in your shoulder unless you work the entire wrinkle, the entire plane, the entire fascial connection, or the entire meridian, however you want to look at it. So that's how we connected your lip and gum to your foot.
I can't believe, because you gave me that answer right away. And so now, I believe that getting to the foot, but guests, I messaged her, I'm like, okay, I got to find this out. What can I do? And I think it was 2 seconds later, she's like, here, look this up. I'm like, wow, she knew this right away. So I was like, because others were like, oh, well, I think sometimes we do get so much in our heads of thinking just what is here. And even though, especially I talk all about getting to the root cause, but that is the area where I don't think I could talk long enough to Bre, because my training, there's so much, and I appreciate the foundation, but then I realized, wow, if we had some additional foundation, even if we just had our minds opened to the fact that sometimes looking to the foot for our tooth issues would be so beneficial. Because I will also share, and this isn't all about me sharing my acupuncture sessions with Bre, but I went in one time and I was getting ready to have a filling replaced. And I'm like, Bre, it's just a little something, and it's going to be replaced. I think it was a week later. I'm like, it's just 1 week, and I don't really have pain with it. She put a point on the opposite foot. It was the opposite side. It was my left side, left tooth. And immediately I'm like, if we as dentists knew how quickly something could be addressed, we could get people through so much pain easier. And I appreciate that. So if you want to talk a little bit about that too as well, Bre.
So I think it's interesting how you're saying from your perspective, oh, we can fix tooth, pain, issue, whatever, around that structural, not necessarily acupuncture cannot fix what a filling needs to be in place for. But anyway, by looking at the feet, or sometimes it would be on the hands, depending on what tooth we're dealing with, I look at the opposite way, where sometimes I'll run into situations where someone has this chronic nagging pain, shoulder, leg, knee, whatever. And I've exhausted all of the obvious things we do, manual muscle testing, all of that to try and figure it out, muscle chains, all of it. And then I sit down and think, tell me about your dental health. And it'll be the opposite. They will have a bad filling in a tooth. That tooth is related to that meridian or that organ, and it's going to show up in the knee or, wherever. So you say you wish you had a little bit of training in how something outside of the face and mouth can help in the face and mouth. Well, I'm the other way. I wish we had more training in how our dental health plays such a huge role in the rest of our body's health. Even when it comes to musculoskeletal pain, that restriction caused by the filling that was needed or the root canal that was needed, if that isn't properly and fully addressed, it can lead to chronic pain elsewhere in the body. So I think it's funny how we're both like, oh, I wish I knew more from what you knew. We'll just trade knowledge, right?
We do, because basically what we need to know is if what we are doing, whatever health profession it is, if what we're doing isn't staying, if they keep coming back with that same problem, we need to look elsewhere and get everything to work in harmony together. Whereas, on my end, the reason why I would really like to have at least known about that point is that oftentimes people, if they're in such heightened pain, they can be much more difficult to then work on, right? So if we can get something to help calm them down, get them through, sometimes people then really, they go right to certain medications. Oftentimes, if they're going to prescription medications, leads to many ripples negative, right? But the takeaway really is if we had just a little bit of knowledge of what to do if what we're doing isn't staying, like on your instance, if you keep working those points, but it's not staying for them. Same thing if they're coming into us and like for periodontal disease, they just keep coming back to work better together. And that's why I think I could talk to you for probably just weeks on end, or just have to. I've had one friend out in Washington tell me that dentists, and I think I shared this with you, dentists can go through acupuncture training and not have to do the full 4 years. So we'll see. Maybe, maybe my future is to just take some more classes.
Right. Well, let me tell you. So I did not really get into acupuncture and dentistry until I met you, because you were asking me questions and you were also just kind of enlightening me to where other places I can make connections for my own patients. And I remember coming across a study that they are able to, I want to say induce, I'm not quite sure if that's the right word, but induce analgesia. So basically your numbing agents will work faster and better when paired with certain acupuncture points. And that to me was just like, oh, wait a minute. So what if I gave you one acupuncture point that's going to help calm the mind, to help relax them before the procedure, and then one more that's going to help your numbing agents work better? Can you imagine how much more enjoyable dental work could be? And it's so simple. So yeah, there is a future for collaborative dentistry and acupuncture. I know it.
I'm looking forward to that. And speaking of our collaboration, so we will be doing another episode, but we are going to do the preview. I ask all my guests if they are anxious and wanting to share in the Take 3 for Me movement. Well, our guest today is the co-creator of the Take 3 for Me movement. And so she is going to lead us through this because it came about from different aspects. Bre, if you'd like to share how you got into face yoga briefly.
Yeah, so I have a bit of a unique way I got into face yoga. Honestly, so I am a cancer thriver, and I remember laying on my couch one day knowing I needed to get up and move because movement helps in so many ways, but I just couldn't peel myself off the couch to go do something. I just was so low energy wise, and I was like, you know what? I remember seeing on Instagram or something about face yoga, and I look real tired. Let's see if there's something I can do that's going to help wake up my face a little bit. So there I am finding something, and it was a 5-minute YouTube routine that I found. And while it wasn't really the movement my doctors are looking for, I was like, yes, I did some exercise for my face. Going to make me look better and feel better. And then, so the next day I'm like, oh, let's do that again. So I did that again. And then it rolled into, well, let me stretch my upper body because that feels good. And so for me, face yoga was what I would go to when I knew I needed to move, because movement is so important for everyone's health, but especially where I was at my health. But I couldn't get the motivation to go do real movement yet, full body movement. So that was my baby step. And you know how getting started is the hardest part?
Definitely.
That was how I got started. And then it was face yoga plus a little stretch. And then it became face yoga, stretching, and movement. So that's how I came into face yoga. And then that was on one side. And I had already met you but I didn't really connect the dots until later. I was like, oh my gosh, for all the things we talk about and that you're coming to me for, I'm like, I wonder if she knows about face yoga, because that could be so helpful for you. Because we talked about like myofunctional therapy and all of that. And I don't remember who asked who first. I actually think you said, have you heard of face yoga? I was like, oh my gosh, I was just going to ask you if you had heard of face yoga, because I thought it worked so well with, your philosophy and what you do.
Yes.
So that's how I found it.
When I had found face yoga, I'm like, wait, these are all basically myofunctional therapy exercises. And Bre and I have been talking about how we really needed to get the caregivers, mostly moms, but the caregivers to really understand the importance of myofunctional therapy exercises to increase nasal breathing. And I'm like, we got to make it so that they understand that they can, how much better they can feel, and bonus, look with it.
Right.
And then we did one of the Connections book clubs, and we grounded, we did the face yoga, we did the mindfulness portion, and everyone had great things to say. And we started the Take 3 for Me movement. And now, since we are running a little bit low on time with you, Bre, if you'd like to go ahead and start our Take 3 for Me portion of the podcast.
Did you have a gentle movement in mind that you wanted to do?
Oh, a lot of times we just, since the readers or the listeners, most of them won't be able to see us. Those that are watching us on YouTube.
Very true.
So I'm sorry. We just kind of say, hey, if you can stand up. A lot of people will be driving and sitting down like us. So just move your shoulders, get connected, because you've been sitting here for a little while, get connected with your body. And then we share the kindfulness or mindset reset portion.
Okay, well, let me go ahead and give you another, maybe a little more instructed movement that we can do. You can do it while driving. You don't need to see what I'm doing. But we all know how to roll our shoulders back, right? So why don't we go and connect that with our breath? So you're going to inhale as your shoulders come up. And then exhale as they come down and back. And there you go. That's one of my favorite things, because it connects your movement to your breath and also resets those shoulders and that upper body posture to where it belongs. So now that we've done that once or twice, our mindset reset. So let me share that. I am proud that I'm here to be sharing this with you. It's been a long time coming. It's been bits and pieces, but I am proud of both you and I and how we kind of diligently kept working on it. And now we're really kind of enjoying the fruits of our labor. So I'm very proud of that. I am grateful. Oh gosh, so many things, but let me just say I'm grateful that I have found a circle of moms, a circle of health practitioners, a circle of friends that align with my beliefs, because everything is better when we work together. So I'm very grateful for all of the women that I have found, a lot of them through you. So thank you. I'm grateful for you.
Oh, my pleasure.
And so my intention today is I get to go do some infusion therapy after this. And my intention is to sit there and read. Sometimes I try and get myself busy with work or distractions, whatever, but I'm going to sit and read a good book while I'm there.
Thank you so much for sharing all that with us,
Yeah.
Bre. Oh, it has just been such a pleasure to have you on this podcast. And I know we're going to be getting a lot of questions, a lot of when are we going to have her again? And hopefully this can even be like a recurring thing. We didn't get past question 1.
Right. I realize that. So
is there anything else that you would like to share with the listeners?
One thing that I would like to share, it's kind of been my message lately, keeps showing up in my life, is it goes with our quote. Grant yourself grace, grant yourself time for rest, because rest is actually an active action. It's not anything passive, really just embrace your time for rest, grant yourself grace. And also remember to kind of go with the seasons if you can. There's a season for rest. There's a season for action. It's summer, officially summer. So we're entering the season of action. So if you got a project that's been on your mind, now's the time to get started on it. But yeah, that is the message I'd like to send you guys home with, grant yourself grace and just go with the seasons.
Oh, thank you so much, Bre. I appreciate that. And stay tuned for next month's episode. Until then, enjoy all those magical mama moments. Thank you.
Thank you so much for having me.